Good evening, guys. This is discussion C for you. We're going to discuss the topic of um, bringing the hospital to your home, okay, for seniors who need hospital care but choose to have it at their own home. So that is discussion C for you. I'm going to do the presentation in a few minutes as soon as I get set up. Give me a couple seconds. Give me a few minutes, guys. I've set up my notes. Give me a minute. Okay, here we go. That headline captures a growing shift in modern healthcare. The hospital at home HaH model, which allows patients, especially older adults, to receive acute hospital level care in the comfort of their own homes. Why why this shift? Traditional hospital stays can be risky for some people, particularly seniors. Hospitals can increase the likelihood of falls, infections, delirium, and even long term functional decline. HaH addresses these issues by replacing a hospital room with a safer, more familiar setting while maintaining close medical overnight. Here's how it typically works. After a ER after a visit to the ER or an evaluation by a physician, a patient who a patient who needs short-term hospitalization may qualify for HaH. A safer a safety assessment ensures the home environment supports care, e.g., electricity, clean space, oxygen setup if needed. Okay, the hospital provides equipment, daily nurses visit, doctors consultations, and access to technology that allows 24/7 remote monitoring. Originally a small pilot, HaH uh, scaled quickly during the pandemic when hospitals' capacity was stretched. Medicare waivers allowed hospitals to receive reimbursement for home based acute care, making it a viable, cost effective solution for, for hundreds of hospitals nationwide. critically, critically is not just for the wealthy. Programs have been implemented in a wide range of neighborhoods and shown to reduce hospital readmission rates, particularly among Medicaid patients. So just this isn't just a cute twist on home care. It's literally the same intensity of treatment you'd get in the hospital, brought to your home or brought to your front door. Would you like to explore how this model could adapt for rural areas, or perhaps how it intersects with end of life care planning? The hospital at home HaH model offers a compelling blend of clinical safety, patient comfort, and health system efficiency. Based on the page content and broader healthcare insights, here are some of the standout advantages. One, reduce risk of hospital associated harm. Older adults face heightened risk of falls, infections, delirium, and functional decline in traditional hospitals. HaH minimizes exposure to these risks by delivering care in a familiar environment. 3. Personalized and comfortable care. Patients tend to feel more at ease and retain greater independence when treated at home. This can improve mental well being and even speed up recovery. Lower readmission rates. Programs across various neighborhoods have shown that HaH can lead to fewer hospital readmissions, especially for Medicaid patients, likely due to better monitoring and more consistent follow-up. 5. Cost-effective delivery. HaH avoids many overhead costs associated with inpatient care. With Medicare reimbursement pathways in place, it's become a financially sustainable option for hospitals and patients alike. 6. Enhanced family engagement. With care unfolding at home, family members can be more involved in the process, supporting person centered treatment decisions and end of life planning if needed. Rapid scaling and flexibility. Initially piloted in small programs, HaH proved its scalability during the pandemic. It's now a core element of flexible care delivery, particularly when hospital capacity is stretched. Would you be interested in how this model compares to programs like Hospital at Home Plus, which integrates palliative care services, or how it could be tailored for neurodegenerative conditions like Parkinson's or early onset dementia, while in the hospital at home HaH model holds enormous promise. It isn't without its hurdles. Some of the key implementation challenges include technical gaps, and infrastructure needs. Not all homes are equipped for remote monitoring, oxygen tanks, or infusion therapies. Reliable internet, power supply, and space for medical equipment are essential but not guaranteed. 3. Workforce and training limitations. The model relies on a robust workforce of trained nurses, physicians, and allied health professionals who can deliver acute care level care at home. Staffing shortages and uh, inconsistent training standards can strain scalability. 4. Equal access, equal equality in access. While HaH has expanded into many neighborhoods, rural areas, and underserved populations may still face access barriers, including fewer participating hospitals and logistical challenges in delivering in home services. Five, payment and regulatory complexity. Although Medicare waivers helped scale HaH during the pandemic, ongoing reimbursement depends on shifting regulatory frameworks. Hospitals must navigate federal and state rules that weren't originally designed for home-based acute care. 6. Clinical risk management. HaH requires precise protocols to manage emergencies remotely, ensuring rapid escalation pathways, ambulance response, and integrating real-time vitals monitoring are critical safety measures. 7. Caregiver burden. While families often welcome the chance to participate more actively, home-based care can inadvertently shift physical, emotional, and logistical burdens onto caregivers without proper support systems. Would you like to explore some health systems would you like to explore some health systems are overcoming these obstacles, like through public-private partnerships or mobile integrated health teams? Healthcare systems are getting creative and ambiguous in addressing the barriers to implementing hospital at home programs. Here are some of the most promising strategies in action. Mobile integrated health teams. Paramedics and community health workers are being retrained to deliver more than just emergency care. These mobile teams can respond to urgent needs. Assist with medication administration and provide community continuity continuity between visits. 3 public private partnerships, collaborations with home health agencies, telehealth companies, and tech firms are expanding care capacity, especially in underserved areas. Some hospitals are partnering with logistics companies to handle rapid equipment delivery and setup for tech innovations. Remote monitoring tools with AI driven uh, alert systems, wearable biosensors, and portable diagnostic kits make it safer to detect uh, deterioration early and intervene quickly, almost like having an ICU dashboard at home. Standardized training pathways. Give me 1 second. New certification programs are being developed for HaH specific roles. This ensures nurses and other professionals are equipped to handle the unique demands of acute care outside traditional facilities. Policy and advocacy and flexibility. National organizations are pushing for permanent reimbursement policies. In the meantime, some states are experimenting with Medicaid waivers to expand access in and sustainability beyond the paramedic era. Emergency regulations. Home environment adaptation support. Hospitals are deploying teams to prep homes, installing backup generators, internet boosters, and even home modifications to ensure safety and continued care. Caregiver support integration. To reduce burden, programs are providing caregiver training, 24/7 hotlines, and short term respite services. Some even offer modest stipends or integrate social work support to ease emotional stress. These solutions are turning HaH into a higher performing scalable model, not just a makeshift response to hospital crowding. Would you like a look at how these strategies compare internationally, say between the US and Australia's approach to HAH. Healthcare professionals are offering nonsense feedback about hospital at home HAH solutions, balancing euthanism with calls for refinement. Here, here's a snapshot of what's emerging. Strong support for patient outcomes. Many clinicians report better recovery trajectories and mental health outcomes among HAH patients. They see fewer hospital induced complications and appreciate the opportunity for more person centered care. Appreciation for expanded roles. Nurses, paramedics, and allied health workers often welcome the shift to more anonymous, diverse roles in mobile health teams. However, some express a need for clearer protocols and stronger support systems in the field. Four, caution around clinical risks. Physicians emphasize that while HAH works well for stable conditions, acute deterioration remains a concern. The need for fast exhalation pathways like streamless ambulance transfer or vital ICU consults is a common theme. Mixed experience with tech integration. While remote monitoring tools and biosensors are phased, some clinicians find them unreliable in low connectivity areas. There's also a learning curve that isn't always addressed in existing training programs. Concerns about inequality and burnout. Frontline workers stress the importance of expanding caregiver support and ensuring rural and low income populations aren't left behind. Without proper funding and staffing, they worry HAH could widen existing healthcare gaps. Optimism about policy memorandums. Many healthcare leaders feel the recent policy shifts like Medicaid pilot waiver and Medicare advocacy could legitimize HAH long term, but they weren't clear. More consistent regulations to reduce administrative friction. In essence, the HAH model is being met with cautious optimism. Clinicians are excited about its potential, but vocal about the support and safeguards need it needs. Would you like to delve into case studies that show how clinicians are adapting this model for complex neurodegenerative conditions or late stage palliative care? Okay, folks, so that is it for tonight for shows. Unless I jump back on later for a show or two. But for now, Gator Wellness, take care, folks. Have a good evening.